Good morning, and if you are just joining us, we will begin shortly. We're going to wait just another minute for folks to join us, and then we'll go ahead and get started. All right, let's go ahead and get started. Again, thank you so much for joining us. I know everyone is busy, and at 11 o'clock hour, you're probably taking valuable time out of your day. So I just want to extend that appreciation to you for taking your time to talk about this important subject. My name is Jason Davis. I am the spokesperson for Lane County Health and Human Services. And it's my department who has been spearheading this project for the Stabilization Center, working with a broad swath of the community and community partners. And really our goal today is to inform you about where we're at in that process, what the Stabilization Center is, ask for your feedback, and allow you to have an opportunity to ask direct questions to us, to our panel members, who we'll introduce after our brief presentation, and just have some good discourse. First off, let's go through some housekeeping items. So we will have both a chat function and a question and answer function that you'll see at the bottom of your screen there. The chat function is really just for you to chat amongst yourselves. The Q&A is where you will ask those questions of the panel members. We actually have some folks behind the scenes who are compiling questions so we can identify common themes, and then they'll ask those questions and we can discuss them. So please do feel free to jump in there and ask your questions even during the presentation, especially if they come up something that you're seeing in the presentation you want to ask or talk about. We obviously will try to keep our communication on this free of any kind of hate speech or expletives. And if we see that happening, we'll go ahead and disable the chat or the Q&A. And so let's go ahead and be free of that if possible. So right now, I'll just go ahead and dive right into our presentation. I'm going to try to keep this as brief as possible so that we can get into the conversation part, which is, I think, why most of you are here anyways. The PowerPoint should be visible on your screen. If it's not, someone jump into the Q&A or the chat session. If anybody's having any troubles, let us know, and we will make sure and help resolve that for you. Also, just one brief thing I want to mention before we get started is that we do have both a website and a mailing list that we would love for you to either visit the website or sign up for our mailing list. And we will include information about how to do that. That way you can keep up to date on the progress of the project, and we can hopefully answer any questions that you might have from here on out. So first off, the Lane County Stabilization Center. What's the problem? Why are we doing this? As most people in our community are aware, we are experiencing more and more instances of addiction, of individuals who are experiencing homelessness, and just generally reduced access to our mental health continuum of care. Our emergency services are overwhelmed, which is a problem for literally everybody in our community, and our residents and businesses are concerned about public safety. Obviously, we're seeing those impacts sometimes happen in real time. So the answer for us really is a stabilization center. And that begs the question, what is a stabilization center? Most people refer to a stabilization center by the name crisis center. we decide to make the deliberate choice to go away from that crisis center designation because we want to focus on the outcome rather than why someone is coming through the doors. But they do work very similarly. The Stabilization Center the overall end goals is to reduce incarceration, treat underlying needs of individuals who are experiencing that mental health crisis, coordinate existing resources in an expanded way, obviously increase safety in public spaces and reduce costs to the overall emergency system. And I think that part of the presentation that we sort of just jump right into is really that's what we're doing, is stabilizing individuals who are in a mental health crisis. That is the niche of this particular center. It'll be a 24/7, no wrong door access place for individuals experiencing that mental health crisis. And I want to underscore the fact that this is available to absolutely everybody in our community. I think it's very easy for us to just go right into individuals who are experiencing homelessness as the primary user, but that is not the intention. The intention is that it will be available for everyone. So if you're an individual who has just moved to our community, who is in need of mental health crisis services and does not have a provider, or that provider is not available, this center will be for you. If you are a youth who is experiencing crisis and you have nowhere to go, this will be for you. If you are an unhoused person and you're experiencing a mental health crisis, this is for you. It's literally open to everybody in our community, regardless of healthcare coverage, regardless of any kind of pre-existing nature or condition. It provides immediate triage. So when folks walk in through intake, they're assessed and the level of service need is immediately determined. And behavioral health services, including sobering services, will be available there. Obviously, the ability to medicate will be included within that. And then, what happens after the individual is stabilized? Well, there's connections to those ongoing services to help that individual in their stabilization and make that stabilization more permanent. A key piece before I change slides here is the discharge. So what happens really physically? What will it look like when someone leaves the stabilization center? And we will not just let folks walk out the door without those supports. We're actually going to provide physical transportation to their next step. Services, housing, whatever that might be, with a warm handoff to those services. And really, just for those of you who might not be familiar with the term warm handoff, it really is an educated sort of connection. So we're not just showing up at the front door of a nonprofit in our community who serves folks and knocking and saying, hey, do you have any room? There will be those existing memorandums of understanding or connections, and they will be expecting this person. So just a little bit about some of the values that we that are really central to this effort. It's person-centered. So I think a lot of times, when we think about these things, we think very linearly. We start with the problem, and then we go to the solution, and then we figure out how to arrive at that solution. And while we're absolutely have that sort of business sense throughout the project, everything goes back to the individual that we're trying to serve. That is our key priority. And while this will have positive effects that will sort of ripple throughout the community, the focus is on that individual experiencing mental health crisis. It'll be a place to connect for individuals with support and long-term healing. That's a central theme to us, that we want to make sure that this is not just a flash in the pan stabilization, and then that individual is left to figure it out for themselves. This will absolutely be a connection point for folks. And as I mentioned earlier, access is one of our key themes and values. We want to make sure that not only do we talk about this being open to absolutely everyone, but that in our planning phases, in the building itself, in the way staff approaches folks, in the way referrals are given, that it is accessible as possible, and that we are making sure that every pocket of our community is able to use this center. And obviously, the safety is a priority, both of the individuals accessing the center, the individuals who work at the center, and those individuals who are nearby. And then certainly that ripple effect of improved safety throughout the community. So this slide right here just shows you a little bit about not only the project. It says project background at the top there, but it's really more of a societal background, looking at where some gaps are in our overall mental health continuum of care, and then how we've gotten to where we are right now, identifying the need for a stabilization center. Looking back there to 1968, where 911, where we as a nation decided that we needed that line into emergency services and that dispatch, and then go all the way up to the suicide prevention lifeline in 2005. So it took quite a while for us to identify and try to achieve some of that parity with physical and mental health. And since then, that is sort of the trend that we're on, is to really look at mental health and physical health as integrated and needing parity. So we need to have emergency services like we do for physical health, for mental health. And that is a piece that we are severely lacking in our community. While there are plenty of players in our community who are doing crisis work right now, who are providing some level, we don't want to diminish that fact, and we're so grateful for that. There isn't that dedicated center that has been able to expand into this work. We have our slides here. We jump into the fact that there are other places in the country who have pursued a very similar tactic to solving this gap. Looking at Tacoma, that one in particular has a lot of parallels to our community. And then obviously by virtue of geography and a place that we have visited, the Stabilization Center in Bend, we've looked at these campuses and these models and seen how they work, try to glean as much information as we can from them, where they saw success, how they saw that success, and try to apply that as much as possible to our community, understanding that our community is unique. And there are issues and problems here that are absolutely unique to our community. How do folks access the center? Obviously, there will be referrals. So we will be have our partner agencies working with us to refer folks that they come into contact with and have them escorted to the center and intake. Law enforcement drop-offs will be a key component as well. Obviously, law enforcement is an integral partner in this entire effort, and looking at those individuals who should not be in jail but rather need stabilization services will be incredibly key. And then a big component that we like to highlight is the fact that you will be able to walk in, and that's really where we extend this to the entire community. No questions asked, you can walk right through that front door and receive services. This is just articulating those different pathways. So we have a fantastic service in Lane County with Cahoots. Obviously, they will be a key partner in this, and we want to make sure that we already mentioned the fantastic work they're doing. And it is worth noting that they're doing stabilization on the street as in real time right now. And so that resource for them to be able to take folks to a stabilization center will be key to expanding their capacity. But you see the public safety system, walk-ins, behavioral health partners, etc. So how many folks will be able to serve? The overall capacity in any given 24-hour period would be about 42 individuals. So we'll have 14 adult respite chairs. These look like a recliner. Folks come in, they can get comfortable, and they can begin their process. And then 16 short-term stabilization beds for folks who need to stay for a longer period of time. And then those dedicated 12 youth short-term stabilization center beds. The cost piece, I'm not going to belabor this too much, but we're looking at an overall initial capital of around 19 million, annual operating expenses of around 15 million with expected annual revenue of 16 million. Obviously, we're very early on in the process, and the overall business plan, how funding works, will evolve as we get closer and closer to opening doors. So this is just kind of meant to be sort of a marker that we can reference. And if we're looking at that 19 million as our figure, then we're around 42% there with our initial capital. One of the first questions I get is we've done quite a few neighborhood organizations, to presentations to them and other partners in the community. The first question folks want to know is, where is this going to be sited? And the short answer is, we don't know yet. We're still looking for that ideal space. And part of the reason that we haven't arrived at a for sure space yet, a site yet, is because of all these different needs that we have in the ideal site. And it really does need to be ideal for us to settle on. We can't, in good faith, go and pursue this project knowing that we have deficiencies in the site itself. So some of those, looking just at the building itself, it needs to be 29,000 square feet plus. It'd be great if it was even bigger, so we have the opportunity to expand as our community expands. 75 parking spaces, so that would be one of the bigger lots in town, and have the ability to consider other uses. So that's just the building itself. One of the key places or key components as we're talking about access is that it needs to be within 30-minute drive of 90% of our county's population. So 90% of our county's population really is in that metro area. So it makes sense that it does need to be somewhere in the Eugene Springfield area. And it need, the more accessible it is, the easier it is to get to, the better. Obviously, public transportation will be a huge component for those walk-ins, making sure that it's on a major artery or a route that is easy to access. And then, looking into some of the considerations for law enforcement and other partners who will be physically transporting folks to this center. We want to make sure they don't hit traffic. We want to make sure that we have a clear path for them to be able to use. And then obviously it needs to be zoned for clinical use, which, if you take all those things, just those two columns there, it really limits the available places that we have. And so we have explored several different properties. None have risen to that level where this is a place that we are satisfied with and going to settle on. I will just go ahead and talk about one site in particular that I think a lot of people heard about. And that was a downtown location at 180 West 8th Avenue. And it checked a lot of our boxes, but it was pretty clear right off the bat that we had some work to do around community engagement. We had some work to do around making sure that we explained the use of this, and we educated our public on the specific model that we were choosing. And we just hadn't arrived at that yet. So we decided to go ahead and pursue that first before diving into that specific location. And so we've passed on that location and really focusing in on the community engagement. And that's I think really, without advertising too much of ourselves, that's something that is a value of ours, is to dedicate as much time as we need to bringing our community on board with this project, because it truly will take broad community support. And then certainly costs need to be manageable. One of the issues that we will continually look at is that the difference between an existing space and then a whole new build, and the cost differences. Obviously, right now we have supply chain issues and inflation, and factoring that in is certainly a consideration. Project timeline, again, I'm going to breeze through this really fast because we want to get on with the conversation. But essentially, you can see by this timeline up here that the talk around this particular project goes back to 2014. We have something called the Mental Health Summit, where we have partners from across our community who meet to discuss the mental health continuum of care. It's a very broad and diverse set of folks, courts, law enforcement, service partners, behavioral health, et cetera. And we did what's called a gaps analysis, where we look at the system, figure out where the significant gaps are, and then talk about solutions. And that's where that initial gap for emergency services in the way of a stabilization center was first identified. We fast forward to now, and we're in a place where we have structure, we have a model in a model called Crisis Now, and we have some experts on the panel who can talk a little bit more about that model. And we have some initial startup capital, and we're looking for sites, looking for and settling on some of those details. One piece that I will mention here, we do have a steering committee. And you'll see that on the what's been done little piece on the timeline. That steering committee has helped guide a lot, if not most, most of the considerations for this stabilization center, and that we owe a lot to their effort and work and thinking behind this. So it's been incredibly valuable. We have members of the steering committee here on our panel today. So you can see, obviously, I mentioned the steering committee. We have consultants who have helped us out. RI International is the name of one of our consulting groups. And then Lane County has taken the lead in sort of coordinating and coalescing all those different components into a project. And right there is where I will stop sharing my screen, and we will introduce our panelists. So I'm going to go ahead and mute my mic and turn it over to Alicia Beamer from Peace Health, who can give you a quick introduction. She's also, and all the panelists are going to talk a little bit about the why for the Stabilization Center. I gave you that sort of, 5-second why, but they have some real pointed experience on this subject and can tell you from their perspective how their systems that they work within could benefit from the Stabilization Center. So Alicia, let me kick it off.
Thank you. Good morning. I'm Alicia Beamer. I'm the Chief Administrative Officer at Sacred Heart Peace Health, Sacred Heart University District, and Cottage Grove Community Medical Center. And just at the risk of aging myself a bit, I will share that I have had the honor of serving, although I'm not a clinician, individuals in our community, Lane County, who experienced behavioral health crisis for the last 25 years. And conceptually, the stabilization model could really enhance the existing services. And as Jason talked about, really close the gaps and reduce silos related to serving individuals with behavioral health crisis. And from a Peace Health perspective, the Stabilization Center has the potential to connect individuals to services in real time that we just simply cannot do that in the emergency department. As Jason shared, it really is about connecting people to the ongoing services. We are very good at stabilizing the medical crisis when individuals come to us and the psychiatric crisis, but really there's a need to connect them further. And a couple examples that I'll share briefly are our youth that are in adolescence waiting in our waiting in our emergency departments for an inpatient psychiatric bed. They can be staying in our emergency department for up to a week as they wait for a bed up in Portland. And in our emergency department, that means staying in a windowless room and really not being connected to services right away, other than the medical services that we provide. This Stabilization Center, however, has the opportunity to provide more healing environment to the youth and adolescent as they're waiting by providing group therapy and peer therapy, peer support, and also initiating services for the family and the youth when they return back to our county while they're still waiting here at the Stabilization Center. And then another example is the opportunity we see about 5 to 20. We see patients. We have 30 patients right now who average 5 to 20 visits per month to our emergency department. And really they do have a mental illness, and but they're really coming to us because they have nowhere else to go. And they're seeking food, clothing, a warm place to stay, and that compassionate care that our caregivers provide. But as you can imagine, it's very distressing for those individuals when they're leaving our facility and it's time to discharge, and we provide them with a discharge packet. But they don't have a phone, they don't have transportation or a way to get to those outside resources that we're providing them. And so the moral distress for us is that we know that how difficult it's going to be for them to connect to those resources. And where we see the benefit of this Stabilization Center is that there's that opportunity to provide that real-time, in the moment handoff for that individual, so they are getting connected to those services that will help ensure their health, safety, and overall well-being. And I think just finally, I think this center and this model not only will serve the vulnerable individuals and make sure that they receive the right level of care in the right amount of time, but it also could help decompress our emergency departments and thus, especially as we're seeing right now, promote better throughput for members seeking emergency medical care in our community. Thanks, Jason.
Thank you. Shauna.
Good morning. It's so exciting to see how many community members are on the call today. Thank you everyone for your time and for supporting this work with us. My name is Shauna Mart. I'm a program manager for Lane County as part of the Behavioral Health Division. And I am a licensed marriage and family therapist, so also a clinician. I have the privilege of working on the team leading this project with our community partners. And at the risk of echoing a lot of what Alicia just shared, I think we're really aligned on our hopes for this project. But the biggest pieces for me is that the Stabilization Center will help eliminate the guesswork of who to call for what, and it provides immediate care. Right now, our system is putting the stress of navigating the system on the individual who is already suffering and likely experiencing one of their hardest days. And I think right now we see how the system is unintentionally possibly further traumatizing someone when they're already taking that vulnerable step of asking for help. I encourage all of you to imagine if someone with a broken leg was told, we don't know how to help you right now, or you have to wait a few weeks to get care, and what that would mean for that individual. So this is really an effort to bring parity and equity to how we treat mental health conditions and behavioral health conditions, in addition, in line with how we're treating physical health conditions. And I think we're all here because we know we can do better. We have excellent services and resources in our community, and we need a way to bridge the gaps. And I think the center will provide that intake and triage with follow-up connection to the appropriate resources. And that way folks can experience more traction in stabilizing and reduce the number of times they have to try, over and over again to get that long-term support and that stability. And I also expect it will help free up other community supports, and that we'll see ripple effects around mobile crisis teams, law enforcement entities, emergency departments, and their response times being better. And as a community, we'll get to see them really getting to do what they do best day in and day out. And then the last piece I'll highlight is that it's been really remarkable to see all of our community partners come together on this project. It's more than just launching a program. I think we're seeing a unifying effort as we're collectively working towards a shared vision and really clear community goals, and directing all of our efforts together on that, in that work. So that's where I'll pause. Thanks, Jason.
Thank you, Shauna. And next up, we have Captain Riley from the Lane County Sheriff's Office.
Good morning, and thank you for letting me be here this morning. I appreciate this. I'm Clint Riley. I'm the Lane County Jail Commander. I've been with the Sheriff's Office going on 27 years. So I've been working in the community a while, and I've been watching this my entire career. If we were to have a stabilization crisis center in our community, many people find themselves in our system that are suffering from mental health disorders or drug addiction or alcoholism. Those three things oftentimes drive someone to, that's what the crime is related to. We see a lot of low-level trespass, disorderly conduct, that the quality of life type crimes that we're seeing in our community can be tied to those three things. And along the lines of like what Alicia said, the Lane County Jail, it's really hard to treat those when we have somebody in this system. Oftentimes when they come in here, it traumatizes them even more, and then they decompensate. The jail environment is not a therapeutic environment for someone that is in a mental health crisis or is going through alcohol and drug withdrawals. So if we had a stabilization center in our community, it would give a more permanent solution to folks that find themselves in these crises and get them the help that they need. And so strongly support it, and that's why I'm here. Thank you.
Thank you, Captain. And finally, to wrap it up, we have Commissioner Lori Trigger. Commissioner.
Thank you, Jason, and thank you to everyone who's taking time. I want to assure everyone also that this is just one of many ways for people to provide input, to engage with us on this project, to answer your questions as this project continues to develop. So thank you for taking the time and taking this step today. I'm Lori Trieger. I use she, her pronouns. I've lived in this community for 35 years. I've raised 2 kids here. I have twin grandsons, and I'm also a former foster parent. And before becoming a county commissioner, I've been in office for just 1.5 years now. For more than 2 decades, I've been a part of our nonprofit service delivery system and community, as well as working on a number of public policy and advocacy initiatives, particularly focused on creating thriving communities and with an emphasis on public health programs and services delivering basic needs like food and shelter to our most vulnerable community members. I am so excited and fully supportive of this project for a number of reasons. And one thing I want to assure everyone is while I'm here I am one of 5 county commissioners, and this project is embraced by and supported by unanimous consent of our current board. We just adopted our new strategic plan for the next 3 years, and got this cool little 1-pager on it. But the first item on the Safe and Healthy County issue area of our strategic plan is a focus on the intersection of behavioral health, homelessness, and public safety. And so this project is the perfect embodiment of that commitment of your Board of County Commissioners to address that. It's a complex and intersectional issue. And so this stabilization center is just one piece. It is not the answer, but it is a part of the solution to this very complex issue that we face in the community. One of the reasons that I'm so fully supportive is also that the community has been asking us for this. Almost everyone I talk to, and that is thousands and thousands of people in the community, as I was preparing to and then running for this office, mentioned the crisis that we have, not only on our streets, but in our homes, and how many people are isolated because of the stigma around accessing mental health services. And partly it's stigmatized because it's not particularly outward facing. It's not something we see happening. We see urgent cares and emergency rooms for physical injuries and illness, but we don't see an outward facing and community-wide accepted norm around people accessing behavioral health services and substance use treatment. So I think this project and these community forums help us go a long way towards destigmatizing and having public conversations about who needs help and why. Because the fact is, if we didn't already know it before the pandemic, we are having really important conversations around how behavioral health and mental health supports are for everyone. It's really just a matter of the severity and the duration and the appropriate kind of service people need in that regard. But mental health care is healthcare, and it is our obligation as the Board of Public Health and as the behavioral health services that we deliver for Lane County to do everything we can to provide this service and this center. So I think really, as we dig in a little more, you'll hear, I know there's some questions about cost and where the money is coming from, but there is a cost to not providing this program as well. And that cost, not only on the financial side, is greater than it needs to be. It's not great stewardship of resources to spend money on crisis intervention when we could be spending more on prevention and getting folks the help they need. And relieving the pressure on emergency services, as we've heard from Peace Health and from our own jail. But it's also simply the right thing to do from a humanitarian perspective, to take care of ourselves and each other and our neighbors and give folks the services that they need and deserve. So I'm very excited about this project. I'm very impressed with the robustness of the partners that have been involved, that have gotten it to this point, and that includes the nearly 100 people that are tuning into this webinar today. So thank you so much.
Thank you, Commissioner. And I would like to just mention before we go any further that we did have a representative from NAMI who was going to be joining us. Unfortunately could not, but we do anticipate having them involved in future conversations. In our future meetings and our future community presentations, look forward to them being present as part of the discussion element or Q&A as well. So we have a lot of questions coming in from folks. I cannot both talk and read those at the same time. So thankfully we have people that are categorizing those and trying to explore general themes. So if you do have a specific question that you don't feel like we got to, if you put that in the Q&A section, we will not let that go unanswered. We will reach out to you, especially if you put your email address, and make sure you get an answer. So just FYI, if you don't feel like we got to your question, we will find a way to do so. Also, we had a question right off the bat, folks wanting to know where the information is going to be available after this. We will be posting a recording of this session as well as the PowerPoint presentation on our website. And we will also have that, if you sign up for our mailing list, we will put links in that in email out to you. So you will be able to receive those. Just reassuring you that there will be ample ways for you to not only access the information, but to be involved going on further. So right off the bat, let's dive into some of these questions that we're seeing. This one's actually directed towards Alicia Beamer of Peace Health. Question on how this service will differ from existing services, how the Stabilization Center will be different from what you're doing right now at the hospital. And then also, if anybody else wants to join in about some of the services that currently exist in the community. Alicia?
Yeah, thank you. I think the Stabilization Center model has really the potential to, as I kind of shared, to enhance our model and to complement the services that we're already providing. For example, our behavioral health inpatient unit, being able then maybe to have a handoff where that individual could go to that stabilization center, or at least a referral, so they know that, and then they can also get connected to social services, getting their Oregon Trail card set up, getting food security, those issues, supporting that, helping to support with the handoff to Lane County Behavioral Health in more of a real time. So that is a way that this center can really complement our inpatient service, and it will most certainly complement our emergency departments, where we can refer those individuals to the crisis center or the stabilization center that will be open 24/7, which we currently do not have, and for them to go have a nice warm place to stay overnight, and then again get connected to those services in more real time, rather than having to go around the county to get connected to those services. And then also it will complement our youth and adolescent population as well. It has that potential. Thank you.
Would anyone else like to comment on the difference in services or how this center will be unique?
I think I would just add, as people will, if they haven't already, they'll start hearing more about the county's River Avenue facility, the Shelter and Navigation Center. And that is, as Jason mentioned at the beginning, this stabilization center, while we clearly have an evident crisis on the streets of people needing mental health services, it is for everyone, this behavioral health stabilization center. The Navigation Center on River Avenue will be a 75-bed low barrier shelter and navigation services for unhoused neighbors to understand what services are available to them and where to get them. So it is another one of those puzzle pieces of the whole system that we're working to fill in, but it is not the same. It is complementary, but it is very different in terms of the services provided and who it is serving.
That's a great point. And certainly that question has come up a lot, especially with the Navigation Center moving right along. Exciting to see both services hopefully soon available. We have a question for Captain Riley. Would this center be open as a support for deflection or diversion from jail for individuals who are not appropriate for full criminal justice diversion? Specifically, could it be used as a temporary placement in the following situations? This is very detailed, sorry. Pending initial forensic evaluation, between determination of unfitness and placement, and pending placement in the community. So if you want to maybe tackle the first part of that question about will it be eligible for diversion or deflection, I can remind you what the second part is.
sounds good. That's actually a great question. If we had a stabilization center right now, it would give local law enforcement many options in the field to not even introduce somebody into the criminal justice system. They would be able to handle the situation. Oftentimes with Cahoots, there, our mobile crisis team, they would be able to take somebody that's in a mental health crisis or publicly intoxicated, where there's a disruption going on in the community. Right now, we have two options for law enforcement, either to try to take them to the ED or to take when the emergency department or take them to jail. And oftentimes it turns into a trespass or disorderly because there's no other options in our community to resolve the situation. A stabilization center would be a more humane approach to do what we were talking about before, but also it would divert people out of the criminal justice system to get them more help on the back end through a stabilization center. So, and then to go into the second part, I think you'd see far less people falling into the fitness to proceed and the state hospital if they weren't in the criminal justice system. Those folks come to jail, and when they're in jail, they decompensate. And while they're decompensating in here, that's what causes the fitness hearings, the motions that the court, that the attorneys start to file, which puts someone up at the state hospital trying to get them fit to proceed for a trial. If we took them out of this system, we would see better results and more of a solution-based model than what we have right now in our community.
And then the second part of that question, they had some specifics around pending initial forensic evaluation between termination of unfitness and placement and pending placement in the community. But I think you sort of touched on that, but is there anything else you'd like to add on those?
Yeah, without getting too deep in the weeds, it gets pretty convoluted, but you have two systems someone can go through: a civil commitment, which happens through an emergency department and outside of the criminal justice system. When you come inside the criminal justice system and you're in jail, it's a fitness for a motion for fitness to make sure that you're fit to stand trial, that you understand the charges against you, you understand the courts, the attorneys. So when someone goes to the state hospital for a fitness, it's to make sure that they are fit to stand, represent themselves and understand the court proceedings. So oftentimes we're sending people to the state hospital for very low level misdemeanor crimes to prepare them for trials that may never happen. And so the stabilization center will be like Commissioner Trigger said too, it'll save money. As we invest money in that system, it'll save money and it'll actually, again, a better solution to help people.
Fantastic. Thank you, Captain. Anyone else like to add anything on the law enforcement side before we move on?
Jason, I think I'll just add, it's important to understand that intersection, but a lot of people enter the criminal justice system because of their mental health issue, and they engage in criminal activity because of their inability to manage living in society. So this is not only, this just will, as Captain Riley said, I just think it's so important how many people this will keep from engaging with the criminal justice system at all. That's not the right place for them to begin with. It's a symptom of their need for these services that they're in that system.
Great, thank you. So we are receiving quite a few questions and input around the idea or the concept of incorporating individuals with lived experience into the planning process, into how we develop this center. And first off, before I punt the question over to one of our panelists, I want to say that that has been a component. It is a component of most of the projects, regardless of what our project is, the community that it's serving or the need that it's filling. We always try to identify individuals with lived experience and make that a strong component of how we plan, obviously recognizing that their experience is probably the most beneficial to our plan. We're serving them, so we should figure out how they access the center, how they are able to best be served by the center. But a part of that has been through our steering committee. And there will be continued involvement and opportunities for additional individuals with lived experience to contribute their input. This panel discussion is by far not the only way. And for individuals who are interested, we can absolutely connect you, and we will put in the chat how to do that. But first off, I'll just put this question over to Shauna Mart from Lane County Behavioral Health, who can talk a little bit about what we've done so far and then our future plans.
Yeah, so As Jason mentioned, our steering committee is comprised of multiple community partners, and that does include multiple consumer organizations. And then this is a multi-year project with several phases. And as we get into the details, not only of the vision and scope of the project, but the actual implementation aspects of how we'll roll out these services to the community. There will be several work groups and other feedback loops for consumers and folks with lived experience to weigh in on the process. And then the other piece is the workforce development. The majority of the staffing model for the actual center and day-to-day operations, it has heavy representation of folks with lived experience providing the services and support directly. So someone walking in the door would be greeted by someone with lived experience, and they would receive support from someone with lived experience for the duration of their time at the center. So we like to say that it's the first face they'll see and the last face they'll see. And that's really part of the overall fairly robust trauma-informed approach to these services. They're warm, they're welcoming, they're on the person's terms, right? Someone will be coming in and saying, I want help with these things, and that's where the support will start. So definitely that person-centered piece that you saw in the PowerPoint. I could talk about this for a long time, but I think I'll stop there for the sake of time.
Well, and I'll just ask if there are any other panel members who would like to contribute thoughts around that topic. All righty, we will go ahead and move on. And this is sort of an open question. I won't pick on one particular panel member, but I think given our current climate with staffing shortages in multiple sectors, it's worth talking about. How do you plan on recruiting enough individuals to staff this center given the current situation? So if anyone would just like to jump in on that one, we can certainly talk about it.
I can start, and anyone feel free to add anything that I miss, but that is a key piece of the planning around the implementation. We don't want this resource to duplicate or replace any existing services in the community. It's really to serve as a bridge. And one piece of the project that we haven't talked about much here is a campus of connections approach. So it's really an opportunity to co-locate representatives from all of the services across our county and our system under the same roof. And that allows opportunities for us to not only have a provider who would have the direct workforce of staff supporting the day-to-day operations of the center, but we'll be able to share staffing so that we're not continuing the cycle that I think we're all seeing where we're hiring each other's staff. The pool of experienced individuals is what it is in Lane County, but this is happening in the context of a lot of workforce development opportunities. The state legislature and other funders are allocating resources to building the behavioral health workforce, and we're increasing the pipeline for staff who will come into this career path. And I think the other piece is, again, having folks with lived experience join that workforce and making sure that there are training opportunities, living wages, housing for people who are doing this work. So there are a lot of strategies going into that. So I guess it's a multi-pronged approach in short.
I'll just add to that. I think when you look at that as well, it's not even the staffing part, but think about the relief that it's providing to the individuals we're serving, because they're not going from all of these just different locations trying to get to one area of town or the other to receive those services. They'll be able to receive them in one place and then in a more of a real-time fashion with that warm handoff. So I think that's also a benefit, and will be definitely more efficient.
I'll add one piece to that too. I'm often told by colleagues around the state that they don't see counties that collaborate like Lane County does. So I think there's so much energy and so much involvement, and so many partners want to see the Stabilization Center get off the ground and go, that I think there's going to be a ton of collaboration, and there's really good people in this community that want to be part of that. And I think we're going to have people that want to work at this and want to help. And this is near and dear to lots of people. And so I am confident that, and I am one of them, along with several of the other folks on this call. We've been at this for a few years now of trying to get a stabilization center, get funding, talking about it. And I know law enforcement, the courts, the hospitals, behavioral health, all of our nonprofit folks in the community, we've been talking about this for a while, and we're excited to get it going. So I'm confident that we'll get it going.
Yeah, I'll just throw in on that question that the challenges ahead of us around workforce, I mean, they're the challenges that are here and ahead of us, shouldn't prevent us from moving forward with the program, right? We don't ask local businesses to hold off on opening that new restaurant or that new clothing boutique because they might not be able to staff it. You go ahead and you move forward on your business plan, you put it in place, and then the existence of it, right? If we build it, they will come. The existence of it helps create the, that opportunity means people come in. The other piece that we haven't heard mentioned is we have several institutes of higher learning here in our community, a community college, some private universities, and of course, the University of Oregon. And many of them have, social work programs and other compatible. And so this could also be a really wonderful way to have folks who come to our community to learn and get degrees in fields related to these services, and then stay here to have a job in the field that they came here to study for.
And before we move on from you, Commissioner Trigger, go ahead and unmute your mic. We have a question for you, and I'm sure that everyone can jump in on this. How available will those next step services be, considering the long wait list that many people are experiencing, especially when it comes to housing?
Yes, we need to have another 1-hour webinar on that topic alone. I think, it was mentioned, this idea of a campus of connection, the integration and collaboration across different agencies and stakeholders all in one place is going to be key to that. The efficiencies that we'll realize that not only frees up dollars, but frees up staff bandwidth and just time, right? The human capacity that we have at Lane County and in our community with our partner agencies, we're taking up a lot of that time that keeps us from moving forward and innovating and launching new programs. We are moving as fast as we can and doing as much as we can at Lane County. Your local housing authority, your Lane County Housing Authority, is Homes for Good, and we are opening more permanent supportive housing, which is housing for folks who are most vulnerable, coming in off of homelessness with wraparound services. We're opening more units of permanent supportive housing in these last couple of years than we have for the decades leading up to these last couple of years. So that's the MLK Commons out on Centennial. That is the Nell at 11th and Charlton, which is about to add 45 units. That is our partnership with sponsors, building 50+ units for folks coming out of the criminal justice system. So we're working as fast as we can to build the housing that is trauma informed, that includes the services that people need to stay successful and stay housed. And I think the more we can do to intersect as providers with the services that we have, the more we'll innovate and see more services coming online. I will also just say that we are Lane County, so we have 12 incorporated cities within Lane County. This is not just a Eugene problem, and this is not just a Eugene solution, this behavioral health center, or even a metro area one. And so we have, mobile crisis units launching down in South Lane. We have work that we're doing to reach every corner and part of Lane County. So the more any housing that we can build in any community within Lane County alleviates some of that strain and burden, particularly at the lower point of entry on the affordability scale. So that is a big and complex issue. But again, I think this is just, I cannot emphasize enough, this is just one piece of a really complex and intersectional puzzle, but it's a critically important one. And we can't wait for the other pieces to be in place before we put this one online.
Really briefly, would anyone like to add anything before we try to tackle another question? Great. So I'm going to try to fit in, we're gonna try to wrap this up at 11:57. That'll give us a little bit of time to explain next steps. But in that time, I'm going to try to get to two more questions. One has to do with the safety within the facility. I'm going to throw this out to Captain Riley, since you are a safety expert and part of the steering committee. And the person posed a question really about, that youth component and how we will ensure the safety of youth, understanding that there might be people within the center who admit on the adult side who are sex offenders or something of that nature. How will you ensure safety within the center?
Let me answer that two-piece, and I'll throw a piece over to Shauna on that as well, as far as how we're going to separate the youth and the adults. The consultant that came in that's been kind of giving us guidance on some stabilization centers around the nation they've built, they don't have the disturbances, and it's not a chaotic environment like we're anticipating it to be. The way jails look now, the way the ERs look right now, it's a more therapeutic environment. And I'll take my profession, for example. You take the uniform out of it, you take the enforcement piece out of it, and you have mental health specialists, and you have them going to a crisis center that's more therapeutic. It's naturally more calming, and they don't have the chaotic disturbances going on in there. So we've all learned on the committee, they don't have the security issues they thought they would have, that we think that would have in this place. They're not there. They're not present. So it's actually a more peaceful place. As far as the logistical pieces of how youth and adult are going to come through there, I don't know if we've really gotten to that piece yet, but that'd be something we would definitely want to look at.
Yeah, just briefly, I'll add that the youth and adult units will be licensed separately. They'll have separate entrances, and there'll be a lot of details built into the architecture and design that focus on that safety, that flow, how people utilize the space, line of sight. And then there's the staff training incorporates a lot of proactive supervision. There's cameras throughout to help identify safety concerns of any kind at an early point as they're emerging. And, to Captain Riley's point, these programs are running successfully with this best practice model across the country. And we have a lot of partners where we can go tour and shadow shifts and learn firsthand as to how it's working to support a broad array of community members with needs in this setting.
Thank you so much. Commissioner Trieger, you had something to add?
Thank you, Jason. I'm just going to cheat a little bit and go back to that question about housing, but since Shauna said, this really, I just want to emphasize, this facility will be for everyone and anyone who needs its services. The most evident and visible need for us is folks who are on the street now, but there are lots of people who are housed who need these services too, so they can stay housed. So in answer to that question about the shortage of housing, that is real, but there are plenty of people who become homeless because they don't have the treatment that they need, who are currently housed. So it's not as if everyone who comes through the doors of this facility will then we will need to help them find housing. Many people are housed and need these services too.
And then I saw Alicia, you unmuted.
Well, I mean, in our emergency department now, we do take care of youth and adults experiencing behavioral health crisis, and we do have we actually built 3 extra rooms so that the youth would be separated from the adults. And so in touring the center that we are looking at modeling in Arizona, I do see there are a lot of different ways that they can keep those youth and adults separate and also safe, and then also provide them really an environment that's healing and specific to that will meet their specific needs. So.
Thank you so much. And we are running out of time, which is a good thing, because that means the majority of our time was spent talking about your questions, which is what we plan on continuing doing. One that I will just address very briefly is around site location. We had a few people ask where the ideal location would be. And really it goes back to that criteria. We don't have, walking into that criteria, we don't have an idea in our head about where that is. It's more just evaluating each potential property and seeing how it lines up with those parameters. because those parameters are really derived around what we need to provide the ideal service. And we can certainly talk about that more in depth in future sessions, which there will be more. I encourage everyone to sign up for our mailing list, for our email list. Visit our website at lcstabilizationcenter.com. There you can find out how to sign up for our email list if you don't want to do it here. And we will continue the outreach and engagement effort with these Q&A panel discussions and provide opportunities for your input. We will be forming our community input teams and sessions. We can talk a little bit more about that. This will continue through the summer into the fall. And of course, as we begin to identify potential sites, we will notify you of those and talk through those, fully vet those. So again, thank you so much for joining us this afternoon. Thank you, or this morning rather. Thank you so much for our panelists. And it's important to note that these panelists, I could take any of your questions and throw them out, and they have the same answer because they've all been working in concert with each other on this project. And that's really the beautiful thing, is that this is a community-wide effort. It's not a specific Lane County project. This is a Lane County place, not government project, that we will all work together to accomplish. Thank you again, and hopefully we'll see you at a future session.